Hi, today's topic is breast pain and nipple pain when breastfeeding. So this is fairly common, and many people think that it is so common that it's just normal and that it's something that you just have to push through when you're breastfeeding. Truly, that should not be the case. There can be some discomfort, especially in the beginning as you're getting used to the sensation and your baby's figuring out how to nurse. Or if you're pumping, you're figuring out the sizes of the flanges and how to use your pump. But typically, breastfeeding really should not hurt if it's happening in the right way. If your baby is latching deeply enough and with a wide mouth and using your baby's tongue correctly. So it's really important to really delve into any sort of persistent pain. Unfortunately, there has been a myth perpetuated in medicine as well as in the general lactation world that most pain is caused by breast or nipple thrush. In fact, breast thrush is exceedingly rare. It can happen, but in the absence of any sort of visible thrush or rash on the mom, the chance of this is very slim. Much more likely, the pain is caused by a problem with the latch, which also may be triggering something called vasospasm, which is when the blood flow to the tip of the nipple is essentially kind of decreased as a response to pain or some other things. And that can cause pretty significant nipple pain, often while nursing or just after nursing, and significant nipple sensitivity to the cold as well. Another possible cause is something called dysbiosis or mammary dysbiosis, or some people refer to this as subacute mastitis. And what this is if you think of your breast as kind of like your gut, in the sense that you have lots of bacteria that live there normally, and they're healthy bacteria, and they live in certain percentages together for the health of your breast. And sometimes that can get thrown off by, again, a number of things. Sometimes it's by being on courses of antibiotics. It can be due to having a kind of a hefty production of milk, pain, pumping, especially when it's not happening quite as efficiently or sized correctly, then all of these things can potentially lead to this condition of mammary dysbiosis. This sort of pain is typically a deeper, achy pain, and there's breast tenderness. It may even improve somewhat as you're nursing or pumping and emptying your breast, and then shortly after, the pain starts to creep back and is pretty persistent. So, and this is usually more of a breast pain than a nipple pain, but can be both. So those are actually the most common causes of pain, and there are ways to treat all of this. Typically, I recommend first going back to that latch, and any good lactation professional should be wanting to watch your baby eat at the breast to do a full oral assessment of the baby's mouth and ability to suck, and jaw and head, and all of this kind of fits together in terms of assessing the latch, and likely can figure out some little tips and tricks that can position your baby better at the breast in order to cause less pain and probably help your baby be more efficient at the breast as well. The other thing would be to watch you pump, and if you're pumping exclusively or fairly regularly for whatever reason, to make sure the flanges are sized correctly, and that can change over time. To make sure that you're kind of using the pump settings as efficiently and correctly as possible, and to just kind of explain the system of pumping, because it's no matter what, it's not a natural thing. There's a lot of new pumps out there now that are trying to mimic nursing as much as possible, and that's great. It's never going to be equivalent to the real thing, and no matter what, it's probably never going to be perfect, but it's definitely something that we need to assess when you have breast pain to see if that's contributing. Vasospasm also has treatments. Typically, heat can help, and there's some specific ways to do that I'll address separately. And but also fixing whatever the underlying trigger is. So if either oversupply or pump problems or trouble with latch are causing the vasospasm, then you want to treat that first. The dysbiosis is often, again, treated by taking care of the underlying condition. So if you do have kind of significant excess production of milk, then it sounds sometimes like a good thing, but it's actually really important to try to get that down to better match what your baby really needs. That will often in and of itself help with breast pain and other chronic complications that can occur when you have an excess supply. The next thing is typically to truly take care of mammary dysbiosis, you want to get a milk culture, which will help you to make sure that you're on the right antibiotic ultimately. And it is typically treated with kind of a prolonged course of antibiotics. An option in between that doesn't have any great evidence yet that it works is using specific probiotics to help to kind of get your breast flora back to the balance that it needs to be at. And there are two specific probiotics. One is L. fermentum and the other is L. salivarius. And if you take those regularly, many women I have found do find relief by taking that, as well as helping with whatever the underlying trigger is. So it's a little unclear which one actually helped. But probiotics certainly cannot hurt. Aside from sometimes being expensive, it's a kind of simple, safe thing to try before going on antibiotics if this is a possible diagnosis. Now, many people ask why their pain got better when they were treated with a course of an antifungal medicine. Fluconazole is the most common one used for presumed breast thrush. And that's a great question. Part of what happens with dysbiosis is that you get a lot of inflammation in the breast, and that's that inflammation that really is causing the irritation to the tissue and therefore the pain. So fluconazole actually has an anti-inflammatory component, and it's probably that improves the pain during the course of treatment and shortly thereafter, and then suddenly the pain starts to come back. That's a pretty typical story with women who are treated for thrush, that it just keeps recurring. Of course, sometimes women can have more than one thing going on as well, so one might need to treat a number of things to really get women feeling better. But if you have persistent pain, you should get it checked. There are things that we can do to help. Pain can lead to anxiety and depression and not enjoying nursing and not enjoying your baby. And that's not what motherhood should be about. And so we want to make this part of your breastfeeding journey be as pleasant as possible so that you can enjoy all of the snuggles and enjoy your baby and not dread pumping or nursing. So I hope this is helpful. Please reach out if you are having chronic pain to your local breastfeeding professionals for assistance. The breastfeeding medicine doctors can prescribe medications that sometimes help with these things, but you don't always need that. So we are here when needed and are happy to help. Have a great day.